Hello, my name is Dr. Kevin Bethke. I'm a breast surgeon here at Northwestern. I'm an assistant professor of clinical surgery through the Northwestern Feinberg School of Medicine, and my practice is limited to breast surgery. I see all of my patients through the Lindsay Comprehensive Breast Center, and I primarily see breast cancer patients. I see some patients who are at high risk for breast cancer, either because they have the breast cancer gene mutation or they have a strong family history of breast cancer. I also see a number of patients from throughout Chicago and beyond who have breast cancer, and they come for a second or third opinion. When patients come to me, my goal is to empower them to make a decision. So what I have to do is get them to understand their problem, their diagnosis, know the various treatment options. When they come to me, they're very anxious, and one of the first things I try to do is relax them and make them realize that breast cancer, it's not a medical emergency. It may be a psychological emergency for them, but it's definitely not a medical emergency. So they have time, we have time to sit down and go over the material and come up with a methodical method to find an option that's best for them. I think the key to a good doctor-patient relationship is communication and trust. My job is to communicate the information for them and again to empower them so that they can make a decision for themselves. And I do this in a number of different ways. I have a website where I have a lot of links to the good breast cancer sites where they get good information. I have step-by-step guides for them. I have worksheets that they can look at and that we'll go over together in the clinic. I'm very accessible. You know, if we're going to communicate, they have to feel comfortable asking me any and all questions, and they have to be able to get a hold of me. Phone tag, as you know, is such a problem these days, and email eliminates that problem. And then in terms of trust, they have to trust that I'm doing everything I can to help them make the best decision. I love my job. I love doing what I do. I love the interactions with patients. I love the interactions with my fellow physicians and with the medical students and the residents. And of course, as a surgeon, I also love being in the operating room. The operating room is my sanctuary. All of my focus, all of my attention is on the patient when I'm in the operating room. And, you know, I get instant gratification from removing the tumor, but I also get to use my creative talents in terms of trying to make the breast look as good as I can when I'm finished with the surgery.